So the other question that gets brought up regularly is whether a patient is a candidate for a round implant or a teardrop or anatomical shaped implant. And there's a perception that in general having a round implant will always give a patient a fake or enhanced look, whereas using a teardrop shaped implant or an anatomical shaped implant will give them a more natural look. And in reality it's a little bit more complex than that. Obviously there are different types and different projections of round implants, and so using a more projected round implant will always give a more enhanced look than using a less projected round implant. In fact, the most important indication for whether or not a patient can have a round implant is to do with the height and the width of the breast plate and the position of the nipple. So to fit a round implant, obviously a breast needs to be as wide as it is tall, and the nipple needs to be in the middle. Now someone who's very, very tall and lean in stature may have a breastplate that's relatively taller than it is wide, and so obviously a round implant with a round base won't necessarily fit that person's breastplate. What I see more commonly is in patients that have maybe had a couple of children and breastfed and then stopped breastfeeding and noticed a degree of ptosis, that although their breastplate is the same width as it is height, their nipple's no longer in the middle of the breast. And so obviously using a round implant, it means that the nipple position would be placed on the underside of the breast and the nipple would be pointing towards the ground. And so for those patients, it may be that they're a good candidate for a teardrop shaped implant, because even if their nipple is in the lower third of the breastplate, it'll still be pointing forwards in the correct direction.